Hey, man. The way I look at it is when we're having stuff done at our homes, we always want to get two estimates, right? So we can compare and contrast. The same is true with our health. And it is most important that you ask a lot of questions, advocate for yourself, ask why, and continue to ask why until you get the answers that you need so you can be an informed patient that is not only advocating for yourself, but you're in alignment with your physician and team about what's going to happen to you next. So my primary care doctor, who I'm seeing at this time, that's taking me, scheduling the ultrasound for me, that is, now it's time for me to go have a biopsy. He said, stop immediately. Advocacy is not optional. Advocacy is not optional. It is survival. It's survival.
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, podcast for patients and their caregivers to help them advocate for a precision medicine approach to disease treatment, screening, and prevention. You can find us wherever you find your podcast, but I'm going to send you to my website, genetics4healthcare.com. On that site, you can find all of our episodes where we have the description. You can subscribe to get transcripts if you so desire, and you can also watch the podcast on video. Yes, we got a video podcast platform. You might be watching this or listening to this on Spotify or Apple Podcasts, but we do have a video platform. So if you're watching this on YouTube, look down there, hit that subscribe button, or whatever platform you're on, hit that follow button so you can get notifications for new great episodes like this one. We're in September now. We just finished a look back at our first 20 episodes. And so 21 and 22 were look back episodes. What I learned about precision medicine from patients and what I learned about precision medicine from experts. Go check that out. But this month in September is Prostate Cancer Awareness Month. According to the American Cancer Society, in the United States, an estimated 313,000 new prostate cancer cases will be diagnosed in America. It's the most common cancer of men in America. They also estimate that over 35,000 men will die from this disease in 2025. If you go to the American Cancer Society webpage and look at prostate cancer, there's a page on that site called What's New in Prostate Cancer. And at the very top of that page, the very first section is genetics. Genetics can help us identify which men are most likely to develop or who may already have prostate cancer and not know it. Genetics can help us determine which men might need a second prostate biopsy because the initial biopsy didn't find anything, but you're still concerned. You can also determine which prostate cancers are more likely to grow and spread and therefore should receive more aggressive treatment. Genetics can also help you determine if specific treatments, such as the new targeted therapies, PARP inhibitors, might be helpful for you. And of course, genetics can also identify which men might benefit from genetic testing to see if they have an inherited gene that increases their risk of developing a cancer. And you should talk about that with your family members. The conversation you're going to hear today with my guest was recorded some weeks ago. And the intent was to do a series of Black men and cancer. But this message, this guest message was so powerful. He was so unshakable in his faith and his inner strength when he was talking. And it was so bold, in your face about what he was saying, that I knew that I had to share the full episode with my audience. He talks directly to all men, and Black men in particular, who have the highest rates of prostate cancer diagnosis. Black men are 1.7 times more likely to be diagnosed with prostate cancer, and they're over 2 times more likely to die from prostate cancer. The good news is prostate cancer is very treatable if detected early, and early means stage 1, stage 2, with over 99% of people still alive after 5 years. So I hope you enjoy this powerful, powerful conversation with Eric Williams husband, father, pharmaceutical sales manager, and leader. But his most powerful work is servant of God and humanity. And we're just excited that he was willing, and I'm humbled to share his story because it's very, very powerful, to share his genetics for healthcare journey with us. So let's check it out. Tell us a little bit about your background. You've done a lot. Like you said, husband, father, you've raised some kids. You're an avid golfer. Tell us about how you got here. Where'd you grow up, and how'd you get to where you are professionally?
Great question, man. I relocated to Dallas from Detroit, Michigan, back in 1995. I met a young lady, and I followed a young lady who was promoted with J.C. Penney, relocated to Plano, Texas. And 5 months later, I came down, followed that young lady. We got married and in 1997. And we made two more girls. And now I have three wives. One of 27 years. I have my oldest will be 24 on Monday, and my youngest is 20 years old. She's a sophomore at the University of Oklahoma.
Wow. So from Detroit. All right. It's a
What
big
up,
jump from Detroit. Okay, there we go. Obviously a Lions fan.
Yes, sir. Die hard Lions fan. Been fun to be a fan these last 3 years.
So I want to talk about your fight with prostate cancer. Give us the background of like the events that led up to your diagnosis.
Sure. Prior to my diagnosis, I was receiving testosterone therapy for approximately 6 years, which required me to have my labs done every 3 months. So every 3 months, this happened to be February of 2022, I go in to get my labs and my PSA levels are elevated to about 3.8. And my doctor says, no need to be alarmed. Likely it is an enlarged prostate. I did some reading, took his advice, and I was treated with finasteride for about 90 days. 90 days, had my labs check again. My PSA levels were quote unquote normalized. Everything's good, back to normal, continue my testosterone therapy. Life continues. I'm healthy relatively. And in October of 2023, my PSA level is elevated for the second time. Now it is 4.54. And the doctor says, hey, remember this happened last time, probably just an enlarged prostate. We'll treat it with finasteride. And I said, no, we're not going to treat it with finasteride. I would like to know how aggressive we can be to identify what this is. My motivation now is different because in the background, my eldest sister is diagnosed with stage 4 metastatic breast cancer that had spread to her brain. She'd had a surgery, and now she is fighting for her life actively. So I was very assertive with my doctor saying, hey, how aggressive can we be? And he said, okay, we'll be as aggressive as we can. I will schedule an ultrasound for you. This is October. For those that don't know, October is benefits enrollment for many people in corporate America. And at that time, there was an insurance change. So it prevented me from having that ultrasound as soon as I would like. We had one scheduled for December. I show up to the office over in Irving, sign in, sitting and waiting, only to be told, sorry, this hasn't been authorized by your insurance company. So that was barrier number one. I was extremely frustrated and waited till the situation resolved itself. Got an appointment scheduled for the first week of January 2024.
So that took close to 2 good months, I guess.
Yes. The waiting was painful. It was painful.
Yeah.
waited for the results of that ultrasound, got those in February, and the report read, I actually read it, that it was two spots in my prostate, and based on what they thought they saw, stage 1 prostate cancer, right?
Mhm.
So I'm extremely nervous, scared. How am I going to tell my wife? How am I going to tell my children? When do I tell my children? So the
Let's pause right there real quick because
yes,
I don't want to make sure that those listening understand. I mean, this took a number of months from the time that you had the elevated PSA, having the conversation with your doctor, and thank goodness that you were able to advocate for yourself, right? To be able to speak up and say, no, this is what I want as a patient. How important is that for brothers out there? Because as we know, even generationally, there's a tendency for people to say, well, this is what my doctor says. But, even with your family history, you advocated for yourself. How important is for that for men out there to be vocal when they want something that may not be what their doctor is suggesting?
hey man, the way I look at it is, when we're having stuff done in our homes, we always want to get two estimates, right? So we can
Mm,
compare and contrast. The same is true with our health. I am in the healthcare industry. I have been for almost 30 years. So I'm comfortable in that environment. And I felt very confident advocating for myself. It is most important. I consider myself to know a little, not as much as you by any means, but for the average person who doesn't have a career in healthcare, it can be very, very scary. And it is most important that you ask a lot of questions, advocate for yourself, ask why, and continue to ask why, until you get the answers that you need so you can be an informed patient, that is not only advocating for yourself, but you're in alignment with your physician and team about what's going to happen to you next as you go through this journey.
yeah. You also mentioned that you were taking testosterone therapy, and there's a number of men who this is very common. Um, did your doctor suggest stopping that? Did you continue to take that? Tell us about what was your conversation with your care providers around that?
Great question. So my primary care doctor, who I'm seeing at this time, that's taking me scheduling the ultrasound for me. That is, now it's time for me to go have a biopsy. He said stop immediately. I will go back to the orientation for testosterone therapy, 7 years ago at this point, and he says, testosterone, there's a relationship between testosterone and prostate cancer. It's not a causal relationship. We're still doing research to find out, is it the chicken or is it the egg? So I
Mm,
want to make you aware of this, but to monitor progress, we're going to check your PSA every 3 months to make sure that everything is what it's supposed to be. At the time of diagnosis, it was cease and desist from testosterone because I learned during that process that, testosterone is like gasoline on a fire. It
no,
makes the cancer to grow. So I had to stop immediately, and have not returned to testosterone therapy.
thank you. Thank you so much for sharing that. I know there's a number of people out there that just ensure that you have the conversations with your physicians. Sometimes they go to a male T clinic that may not be their primary care doctor,
Right.
but share those conversations with your primary care physician, and hopefully that the type of rapport and conversation that you had with your doctor can happen for somebody out there when it's appropriate and needed. You also mentioned that your sister was diagnosed with stage 4 metastatic breast cancer. Did you, as far as you know, in your family, did you have a history of cancer of other family members?
Yes, man. Unfortunately, I am very much acquainted with sadness and grief of cancer. At a very young age, my father I was 12 years old, and he was diagnosed with pancreatic cancer. He passed away when I was 12 years old. 6 years later, my mom was diagnosed with, at that time, what we thought was lung cancer that spread to her brain. She passed away 2 weeks before it was time for me to leave to go to college. I have a grandfather who had colon cancer, had a section of his colon resected, and lived for a while in that state, and ended up passing away. Grandfather on my father's side had leukemia. He was in remission for many, many years, but it came back with a vengeance, and ultimately he lost his battle. And then most recently, my oldest sister, who stepped in to be my mom, to make sure that I finished college and I did things right, she was diagnosed. Then I'm diagnosed, and many people don't know is my other sister, my only other living sister, is now battling stage 4 metastatic breast cancer. So, yes, there is a deep family history. And because of that, again, talk about advocating for yourself. The rules around testing for, colon cancer, having being screened. I fought for years because I wasn't old enough to have a colonoscopy, but I fought and I fought and I fought, writing letters so that I could start having colonoscopies around the age of 30, 35 years old. So I've been doing my best to try to stay ahead, given my family history. But I hope that answers your question.
Oh, in spades, in spades. I really appreciate that. Knowing with your care providers, whether it was primary care, urologist, knowing your family history, did anyone refer you to genetic counseling or for hereditary cancer screening?
Never came up once. Never knew it was a thing until I talked to a very good friend named Ron Madison, who called me to say, "Hey, have you ever heard about this?" And begin to, just challenge my thought process, and shared that with my wife. And I'm happy to say that because of that conversation, both of my girls have been tested, because of those ladies in my family. I believe, based on the way that the cancer has um, manifested itself for both my sisters in the exact same way, that lung cancer that we thought my mom had that spread to her brain must have been breast cancer that spread to her lungs and ultimately to her brain. As I've learned, the progression of the disease, when it metastasizes the areas of the body that it attacks, um, it makes sense. I can't go back in history, but it certainly makes sense. And with the knowledge that you shared, along with just the prudence of being a good steward of the lives that God has given me, we made the decision to have both of our girls tested, and they were not. I guess it was negative for the break
B-
brachia gene.
yeah,
Gene
BRCA1 and
correcting.
2.
Yeah,
Yeah,
yeah.
yeah. I'm a little touched, so sorry. Um, so hold on. So it's important that men out there know their family history, and obviously, cancer is close to you in your family, but we have these conversations all the time, and it is, maybe it's generational, maybe it's cultural, but at least it was in my family, that I know that my Uncle June, died in his 40s, but I don't know why, like, because they didn't talk about it, right? And even in
Right,
the 70s, when people got cancer was just kind of that taboo word that they didn't say or didn't mention. So it is vitally important that you know your family history, both sides, as much as you can know,
right,
and have those conversations with your provider. Make sure that's recorded in your my chart or your EHR, no matter what that is, because someone can flag that, and to have some specific conversations around screening and early detection, because obviously it's very important. So getting back into your story, um, getting back into your story, you were biopsied and they said stage 1. So How did you choose your therapeutic regimen? Did you have a say? Were they recommending certain things? How did you arrive on what the course of care was going to be?
Great question. So I finally got a chance to meet my oncologist over at Texas Oncology on October 23rd, I believe it was. No, I'm sorry. I'm sorry. It was after my biopsy. I see him on March the 24th of March of 2024. And he has all of my results, and he invites my wife and I into a room. It has a whiteboard, and he went soups to nuts from the very beginning to PSA levels, what's normal, the myths out there about readings. He went through Gleason scoring. He went through where I was in that stage and said, "Hey, I know that the ultrasound said stage one, but this is stage two." He showed me. He drew a picture of the prostate and helped me see the 12 windows, if you will, and showed me the windows that were broken, for lack of a better understanding of where the cancer was located. Um, Encouraging me along the way that, hey, it's a good thing that it's here versus another part of the prostate. Explained to me that when you go in to do the biopsy, which is very uncomfortable, I was misled in that process that it wasn't going to be bad, you'll be fine. Man, that day I went in for the biopsy, and they take 12 needles, and they shoot these needles into each of the windows that I mentioned, and then they test it to see what's there and confirm, the area that they're going to treat. And what's interesting, if you think about one of those windows, you have the needle that goes into the window, and let's say it goes into the window on the right side of the window, you may not find anything, but if it goes on the left side, you may find something. So it doesn't mean that cancer wasn't there, just didn't find it. So he gave me my options. One was wait, just watch and do anything. And he gave me a really, really good analogy. He said, "Have you ever been on a moving sidewalk in an airport?" I said, "Yes, I'm very familiar with that." And he says, "Does it go fast or does it go slow?" I said, "It goes pretty slow, especially if I'm late for a plane." And he said, "But eventually you get off, right?" I said, "Yes." He said, "That's the cancer. You can wait, but it'll be walking on a moving sidewalk. And at some point, it wants to get off. I mean, get off means into your bloodstream." So
Yeah.
that was not an option. Option two was radiation treatment. There are different types of radiation. He explained to me that it is, painless, senseless. You don't smell it, you don't hear it, you don't taste it. Um, and the side effect, number one side effect, was um, uh, fatigue. It's the only thing that I might experience, as the data says. And then the last option was a radical prostatectomy, by robotics or otherwise. You could have your prostate removed. So I explored the side effects of radiation along with the side effects of the radical surgery. And interestingly enough, that either option had the same survival rate, meaning 90% cure rate. If I take this one or that one. So I'm like, what are the side effects of each? I also reached out to a oncology radiologist that I know well. You and I both know. Shared my situation, my values, etc. And he said, "It sounds right to me that you would choose radiation therapy, but I have somebody else that I would like you to talk to in Dallas, outside of my doctor." I spoke to, again, another radiology oncologist here, a friend of that doctor, and he said, "This is very reasonable. If I'm you, I could see why you would want to choose radiation." So my wife and I prayed about it, and we chose radiation as the option. And that meant that I would have 28 days of radiation therapy, and it would be 250 rays per visit, if that makes sense. I think that's the measurement that they use, rays. So by the time I finish over those 28 days, it is 75,000 rays of radiation that's going into my body that I would
Mm.
have put in over those previous 28 days.
And so, how has the treatment have you completed your treatment? Give us a current status for you.
Yes, man. I started my treatment in I believe it was June of 2024. June of 2024. Round one was on June 7th, and I went 28 days, Monday through Friday. Got weekends off, and day 28 was July the 11th when I rang the bell.
Mm.
And there is a physical bell that you ring. I had heard that expression, but I had never experienced it myself until July the 11th. And my first follow up post, well, the goal was, given that my PSA level was 4.54, the goal was at the end of therapy that it be cut in half, a minimum cut in half. So we'll say, 2.2 or something like that, 2.25. And when I had my first test, that would have been October of 2024. My PSA was better than half. It was 1.57.
Incredible.
And my oncologist was extremely excited about that and explained to me at that time that you will continue to be tested every 6 months and for the next 5 years. And if there is no recurrence, then at that time we can say you are in remission from prostate cancer. But that I'm living, doing well, and I learned a ton in those 28 days. I learned a ton about all the machines that were so scary. I learned a ton about the multidisciplinary team and the different roles that they had in my care. I learned that you can use suffering as a gift to other people.
Hold on right
Um,
there. Hold on right there. You can use suffering as a gift to other people.
yes, sir.
Let's double click on that. From your diagnosis, from being declared cancer free, what did you learn about yourself during this process?
Man, I learned that I am capable of more than I ever imagined. Um, I learned that faith is a choice,
Come on, somebody.
because when we had that diagnosis, my wife and I had just had a wonderful weekend in New Orleans. It was an escape. It was a getaway before things got real. We came home that Monday. We got the diagnosis from the oncologist, went through that whole 2 hour spiel, and we came home and we had a really, really good cry together. Me and her, kids weren't home. And we were in a very, very, very dark, scary place. And we made a choice that night that we were going to win. We were going to walk with our head up high. We were going to go into the very dark place of a waiting room where people are staring off into space. Some are with their family members, some are by themselves, but everyone is looking down at the ground. Um, Darkest place that I've ever been, with lights on.
Wow.
So I asked God to please allow me to be a light as I walk this journey, that every person that I came in contact with would know that He was why I was smiling. I learned that it's okay to be in despair, but you can't stay there. There is an image of a tube of rocks with scripture written on them in the office. And this particular day, I was feeling miserable. And I look over, and the rock said, "It's okay to be scared, but you can't stay there." And I chuckled because God does have a sense of humor, because that is exactly what I needed to hear that day. And the word
Wow.
says that I will have the rocks cry out. And I said, "Lord, thank you for your rocks." And every day that I went in, I got a chance to just make his name great, man. So this T-shirt says Team E. There's a story to it, and on the bottom is a verse, Deuteronomy 31:6. I'll tell you how we got there. That verse reads, "Be strong and of good courage. Fear not, nor be afraid of them, for the Lord thy God, he it is that doth go with thee, and he will not fail thee nor forsake thee." Right? Powerful scripture. The reason that that came to be is because one of those dark mornings when I walk in, my name gets called to go back for my therapy, and in walks in a family friend, a mom of a student that was in my golf program that's diagnosed with metastatic breast cancer. So we stopped right there. She had no idea what was going on with me, and I obviously had no idea what was going on with her. But right there in the middle of that room, we prayed for her because you could see the distress on her face, that of her husband, who was one of my frat brothers. We prayed right there. And as I finished the prayer and embrace with her and her family, I'm walking to get therapy, and there's a gentleman sitting right outside the door. He's waiting for his wife, and he has on a bracelet with this scripture. And he says, "Can I stop you for a moment?" And I said, "Absolutely." He says, "I admire your courage and willingness to share with other people the goodness of God." And he said, "Here, I want you to take this bracelet." And I took that bracelet. It's a rubber bracelet with that scripture on it, and I wore it every single day. What's interesting, I never saw that man again.
Wow.
Never met his wife again um, that day. So I made the choice to be a light in a dark place and find ways every day to just make his name great as I walk this out, regardless of the fear, regardless of the negative thoughts of all the family members that had lost their battle with cancer. I was determined to win. There is in the waiting room, there is a sign for Wi-Fi, and the password is Victory One.
Hmm.
So on the back of this shirt, you can't see it. It says hashtag Victory One. Um, and Team E is the name that I gave my team. And everybody that I met, every new radiologist, every new nurse, I welcomed them to Team E. And they couldn't wait to see me when I came in. I took them lunch, I took them treats when I went, just because they're doing some really, really serious work. They are truly
Incredible,
fighting for
man.
patients' lives every single day. And I just wanted to say thank you because they were amazing to me and my family. And on July 11th, I came in with my team E, invited everybody, all the employees to come. Invited a couple of friends, and I asked the nurse, I said, "Well, how many people can I have that's coming back?" She's like, "Oh, I think we've seen most of like maybe 16. You'll be fine." Well, there was over 20 plus people that came, and they were like, "You know what? Based on how you've been, walking this journey, this is not a surprise at all," and made their day to have that big body of support to come in and cheer me on from the sidelines. It was an amazing, amazing experience, man. Amazing experience.
If you lift me up, I'll draw all men to you. Man, I just appreciate you sharing your faith, sharing this incredible story about, how God used you. I am very apologetic about my faith. We know in medicine, a lot of times we depend on science. We go to the data. Faith is one of those things that you can't necessarily quantify, but you can. you can quantify it. If you know God, um, as my grandmother used to say, I know because I feel him in my soul. I feel him in my bones. You experience that. And as you said, even in suffering, God can use you as a light of encouragement for others. That's an incredibly, incredibly powerful story. Thank you for sharing that with us. For those who are out there, as you mentioned, you're in healthcare, you're in the healthcare industry. So speaking with clinicians comes very natural to you. You lead teams of people, which you mentor and coach them to speak to healthcare professionals. But many out there don't have that background or experience. So how can we get them engaged? We're looking for practical tips from your experience and point of view. What would you say to men watching this right now to get them engaged in this conversation? To one, go to the doctor. Two, talk about prostate cancer, prostate health, just their awareness and getting checked. Because, man, as you know, there are still men out there who don't want to go to the doctor to get a digital rectal exam. They may be hesitant and a little anxious around getting a PSA test, so they push it off. What are some practical tips that you can tell men out there to advocate for themselves around getting access to not only screening, but genetic or genomic testing?
Really good question. I would say that I've learned that prostate cancer isn't just one disease. It's deeply personal. There's a mental component that comes. It has many faces. No two journeys are the same. Some men live with it for decades without symptoms. Others face aggressive, life-threatening battle. That reality hit me hard. I also learned that the way we talk about it or don't talk about it can be dangerous. Too
Absolutely.
many men ignore the signs. They avoid screenings. They assume it won't happen to them. I realized that early detection can mean the difference between life and death. Um, and yet so many men stay silent out of fear. To your point, there's misinformation out there. The silence is costing lives, especially in the Black community. There is no data that says why it's so prevalent, but we know that it's most prevalent in the Black community. I was shocked while going through my journey, realizing that Dr. Martin Luther King's son passed away from prostate cancer. O.J. Simpson, prostate cancer. I learned that prostate cancer is not a death sentence. From the time of diagnosis to being declared in remission, I would have to say that I learned that I'm stronger than I ever imagined, but also more vulnerable than I ever allowed myself to be too, because my vulnerability, it helps people. So talk to people about it. Cancer. It can strip away all pretense. There was a lady that I met while going through, who happened to be there same day, same time. I got a conversation with her as she talked to someone else who was going to ring the bell soon. Her name was Miss Morris, elderly, white, female. We had a conversation, and she said, "You know what? Cancer is the great equalizer. I've learned that everybody here, no matter which side of the building that you're going to, all of us are just human beings trying to take care of our family."
That's right.
And realizing that she had the same cancer that my sister was diagnosed with, but she didn't have the resources that Miss Mary had. And we became friends. She told me that I was the first Black friend that she's ever had.
My goodness.
And to this day, we still stay connected. She brought me breakfast one morning. I had my daughter going in for therapy, and she brought me therapy. My daughter's like, "Who is this old white lady bringing you food, Dad?" And I said, "That's my buddy. That's Miss Morris." Um, she was always there by herself. On the day that she rang the bell, I brought her balloons and a card and flowers, and really made a big deal out of it. And that really, really stuck with her. And she said that cancer is the great equalizer. And I said, "Miss Mary, I understand the metaphor, but the truth is God is the great equalizer." and it's God that brought us together. And I'm so glad that I get to call you friend. And to this day, we are still friends. And I believe that she got a chance to look beyond what the media says about people and to see the heart of God through me. And as a result, I have a really good friend named Mary Morris who continues her battle. To your point you mentioned earlier, I said I learned that advocacy is not optional. Advocacy is not optional.
Thank
It
you for
is
saying that
survival.
again. Yes.
It's survival. No one hands us a perfect treatment plan, right? You had to push for answers. I had to ask more people. I ask experts that are in this area. Open up. Don't be afraid to ask and tell people what you're going through, because I learned that I met men from stage 1 all the way to stage 4. From radiation, I met guys who waited. I met guys who had radical surgery. And someone said that you will rise again. So that let me know that I wasn't alone. I had people that I could talk to. And I have since become the person that people can talk to about this. I learned that, control is an illusion. We have all these plans, great intentions, but God is the master. He is truly, truly, truly in control. Days that I felt completely powerless, but I found peace and focus on what I control, and that was Him. I could focus on Him and His promises. That Deuteronomy 30:1-6, that He was not leaving me alone, that I didn't need to be afraid, that He would be with me. Long answer to a short question. Some practical tips, I would say. Break the silence. Talk about it.
You are a powerful, powerful individual, a true man of God that is put here to be a light for others. And I can't thank you enough, Eric, for just coming on and sharing your story, sharing your testimony, and looking beyond just this interface, knowing that there's going to be thousands of men that are going to hear this and be activated to become engaged better in their health care, specifically around their prostate health. Eric Williams, thank you for being a guest on Genetics for Healthcare.
Hey, I appreciate you having me, but I would be remiss if I didn't really quick give these last few things. I would say for all the brothers that's out there listening, break the silence, talk about it, go to the doctor. 1 in 8 men will be diagnosed with prostate cancer. It's not a old man disease. If we don't talk about it, we don't catch it early. Start the conversation with your doctor. Don't assume that when you get your panel that box for PSA is always checked. Ask for it. Know your numbers. Know your risk. Just like if you're going to buy that new driver, buy that new television, buy that new car, you're going to do a lot of research about it before you make that purchase. Research those numbers. Know your health. And last but not least, I would say be an advocate for yourself. No one else will. The biggest mistake you can make is assuming that one doctor's opinion is the only path forward. If something doesn't feel right, speak up. If your doctor tells you to wait and see, push for further testing or get a second, a third, fourth, fifth opinion. Your life is worth fighting for.
Self-advocacy.
No one's going to advocate for you but you. Self-advocacy is it.
Yeah. Self-advocacy is not an option.
Yes, sir. Yes, sir.
Powerful stuff, man. God bless you.
God bless you. Thank you for the opportunity.